We're going to talk about hip flexor tightness and things you can do to support yourself, get more mobility in the hips. I'm sure you've tried stretching over and over, so we're going to talk about some different things that you can do. So first of all, what are the hip flexors? Where are they? We're going to talk about 4 of them. So the psoas, the iliacus, sartorius, and recfem. So your psoas attaches to your lumbar vertebra and then attaches into the femur, so that when you lift your leg up like this, it can do that because it's attached to this femur, right? The femur is the long bone of your leg. So the iliacus aligns the iliums and then cross fibers with the psoas. So those kind of work together. There's different ways to muscle test them, but they work together when we're thinking of hip flexors. The sartorius attaches here and then crosses down in front of the leg and attaches medially. And then the recfem basically is a big part of your quad and attaches to this bone right here, and then down lower onto the knee. So when we think of that, if there's tightness there, a lot of times you'll see this type of swayed posture in people. Like I see this in a lot of weightlifters. They're really strong, but they kind of stand like this and then their butt out. I call it the J-Lo butt. And a lot of times that's telling me that their hip flexors are really tight. And you'll see these people when they're trying to do a pelvic thrust, they arch their back all the way through, and that's really hard on your low back. So a lot of times when people have hip flexor tightness, it's causing them low back pain because of where it attaches to this low back, right? So you're jamming up all these facets every time you're doing something. So what we're trying to do, and what I want you to think about today, is getting the pelvis into the proper position so we're not in an anteverted pelvis, which would be pelvis rocked forward, that J-Lo booty that I was just talking about. And we're trying to go more for the ballerina booty look. That's how I like to say it with my patients, because you're thinking about tucking everything under, squeezing your glutes, and getting the pelvis to rotate a little bit more posterior. So if you think of your pelvis as like a bowl, you don't want anything spilling out the front. You want to have everything neutral, and you want all the water or whatever you have in your bowl to not spill out. Okay, so let's talk about one thing you can do to lengthen the hip flexors, psoas, and iliacus in particular. So I like to use a hypervolt or some sort of massage gun. The best thing to do is to get in front of a wall. So we're going to do that right now. So I'm going to use my left leg as an example. You can have the other one just lying on the ground. You want to be about, about a foot away from the wall, enough to where you can let your leg relax into a butterfly position. And then ideally you lay down, but I'm going to show you what we're doing first. So you want to turn it on, and you want to think about the way that muscle connects. Remember I said it connects to the low back and then attaches into the femur, the long bone. So you want to go with those fibers, and you want to point the hypervolt towards your spine and up. Okay, so right now we're going to directly affect the psoas in particular. So you turn it on, you would lay back. Let this leg relax. If you try to bring this leg up, you are doing exactly the opposite of what we're trying to do. You're actually tightening that hip flexor, and we don't want that. So this can be very uncomfortable for some people, but you will probably find that it's very tender, and that's good. And then you want to angle towards the spine. And you'll find it. You will find it. So you want to hang out on that for a while until you feel a little bit of relief there. And then you can get up and test it and see if it feels better, and then you know you did a good job. Another thing you can do is try to target the iliacus in particular. So remember that lines our ilium, So you want to angle outwards towards the ilium. So I'll show you here. You want to angle more this way into the pelvis, almost like you're trying to dig into that bone. The psoas is more this way, going upwards. The iliacus is more into the ilium and the pelvic girdle. If you're trying to relax your rectum or sartorius, then you want to hang out along the quads. And I usually like to work upwards with my massage gun to try to release, and just know that they attach to this bony prominence. So you want to make sure you get that insertion point as well and try to loosen it that way. So if you have tried to lengthen it with this, maybe you don't have a hypervolt at home. I think most of you are familiar with the hip flexor stretch. I will just show it really briefly. So let's say it's my left side again. I'm going to bring my right leg forward, going to have my left knee behind me. You're going to press forward, and I'm not dumping into my low back. I'm going to think about that posterior pelvic tilt and then pressing forward in one straight line. So you actually should feel it down probably into the quad and then also into this hip region. To make it more intense, you can bring an arm up. You can try different angles and see what feels best for you. But that is the hip flexor stretch. So let's say you've done that, still not getting any relief, or it doesn't last that long. Maybe you need to strengthen it. I won't lie, I don't think majority of people need to strengthen it, because so much of what we do is in flexion. Walking is flexion. Sitting at the desk, we're already in a flexed position, right? Everything's flexed forward. So I would rather have my patients, and what I typically have them do is focus on, once again, getting to that posterior pelvic tilt position. And that could be through a simple glute bridge exercise, or doing more core focused work, but without the legs going up and down. Because anytime you're doing these types of abdominal movements, you are using the hip flexors that we're trying to lengthen. So, and especially if you are someone who already is weak there, you will probably be exacerbating your symptoms by doing those. Doesn't mean you can't do them, but if you're having pain here, I would highly suggest not doing those. Now I will demonstrate the proper bridge position to help your hip flexors. We're gonna go over the glute bridge exercise. So you lie on your back, and you want to think about that posterior pelvic tuck position that we've talked about, the ballerina tucking. So you wanna push your low back into the ground or the table, wherever you're lying. You want to squeeze your inner thighs in. A lot of times I actually like to have a towel or something else in between my legs to cue you a little bit better, and then squeeze your core. Then you would relax, and then you'd squeeze again and relax. Let's say you want to advance this, then you want to press your low back into the ground, lift up, but you don't want to lose this tucked position of the pelvis. You don't want to dump here, because then you're using your low back muscles and you're actually giving into that hip flexor tightness that's pulling you forward. So you want to fight that and do the opposite. So you want to have a nice flat line from knees to here, almost like a tabletop here, a flat table here. Great. So that is the glute bridge exercise. So let's say you have strengthened, you've tried lengthening the hip flexors, but you're still not getting any sort of improvement, and you've tried strengthening your core without doing those kind of snapping hip exercises with the legs going up and down. Then watch my next video, because I will talk about different chemical stressors that may be causing your hip flexor tightness and weakness.